Hi, my name is Darisha Rush. I'm a student at Ashcombe Community College. Today I'm going to be discussing health literacy and the effects that it has on intimate partner abuse. What is health literacy? What is intimate partner abuse? Okay, well, let's get started. Health literacy is the ability of people to acquire and interpret the information that they receive health wise. Just how much of that information that you received when you went to the doctor or had any type of interaction with any kind of healthcare providers, did you actually understand? Are you able to reapply it or reteach it? For instance, we've all been to the doctor before, where it be we went to get our physical for the year or we're just not feeling well. You go to the doctor, they come in, they take your vitals, things to this nature. How many people don't know what's the normal ranges for vital signs? And when I say vital signs, I mean blood pressure, post ox, that's your oxygen level, your heart rate, your respiration, which is how are you breathing? Are you breathing normal? So when your vital signs are taken and you don't know what's normal, you don't know if it's a problem. Sometimes your vital signs are taken, and unless you ask what they were, the nurse don't give them to you. Sometimes I've been in that situation where I've had to ask what was my vitals. But in asking, if you don't know what is normal, you don't know to ask more questions. That is what health literacy is. Not having knowledge about health. And when you do not have knowledge about your health care or any health care for say, you are not able to make the best decisions for your health care without the proper knowledge. Intimate partner abuse. When two people are in a relationship or have been in a relationship, intimate in any kind of way, fashion, or form, and there's abuse. What is abuse? Abuse could be physical, it could be sexual, it could be emotional, it could be threats, stalking. It does not have to only be physical abuse. A lot of times when you talk about abuse, people think that involves someone actually touching you, hitting you, causing harm to your body. It is different types of abuse. For instance, with intimate partner abuse, sexual abuse a lot of times are not looked at as rape or sexual assault because you're in a relationship with that person. I'm not talking about legally, I'm talking about the person that is the victim or the abuser does not see anything wrong with forcing someone that they're in a relationship to have sex with them. Some people and in some cultures feel as though that is their right. The victim, without the proper health literacy, does not know that that is not right. No means no. It does not matter if you're in a relationship with that person. It does not matter what your culture or your race is or what background you come from. It does not matter. No means no. That's a violation to your right. That's a violation to your body. Emotional abuse, having someone belittling you, insult you, talking down to you, holding finances from you, messing with your mental state of mind is also abuse. It's not right. But if people does not have the proper health literacy to understand what is going on in this situation, improper knowledge, unable to apply it to their situation. I'm going to say that again. When you have improper knowledge on health literacy, you are unable to apply it to your situation. Intimate partner abuse, domestic violence is what most people would understand that as. If you don't have the knowledge, you cannot apply it. And these people are at risk for harm for mental illnesses such as depression, even PTSD. A lot of times we think of PTSD, we think of veterans. They've been to the war, they've come back, they've seen some gruesome things over there that they just cannot get past. And they formulate post traumatic stress disorder, PTSD. Well, you don't have to go off to war to obtain that. Real life, everyday situations that people go through, prolonged history of things, can cause a person to have PTSD. These people are at great risk for their safety because if it turns physical, you can harm yourself. The person can harm you. It can even lead to death. Even mentally, it's harming you because people gain suicide ideations where they just don't want to live anymore. They get so depressed they just don't want to live anymore. They have start having thoughts. What if I'm just not here? It'd be better if I wasn't here. And they start thinking of ways to get out of the situation. If they can't think of how to leave the situation properly, or they are scared of leaving the situation properly because they don't have the proper resources or knowledge to be able to apply it to their situation, they will start thinking other things, taking their own lives. Risk factors when we're talking about health literacy and intimate partner abuse. I have that in the middle because a lot of these coexist with one another. Lack of education. Now, a lot of times when people think of lack of education, they think, oh, a person have not obtained their diploma, their high school diploma, or they have not gone to college, they have not furthered their education. I'm talking more of lack of knowledge because a person could go through high school, graduate, and still lack knowledge, still not be able to apply the information that they to obtain in school to everyday life or not be able to re-teach it. Let's talk about math for a minute. Some people struggle with math. I've always been pretty good at math. But when you start getting into algebra and things like that, we all know in math, if you miss a step, the whole problem is going to be wrong, right? Well, if you miss a step, the whole problem is going to be wrong. If you cannot apply health literacy to your situation and you don't understand what is being told to you, you cannot apply it to your situation or whatever your conditions may be, and you cannot reteach it, you don't you can't begin to think of ways to obtain the resources that you need in order to better your situation. Age. A lot of times we think of older adults when we think of age because older adults, our grandparents, the elderly, people to that nature, a lot of times back in their day, they didn't go past second or third grade. They had to get out in the farm to help their parents provide for the family. So they lack knowledge and education. A lot of times they don't understand what's being said to them when they go to the doctors. That's why uh, a sibling, a daughter, or a son, a lot of times it's best to have someone with them so that someone else can understand or try to understand what is being said. They don't understand the information, they cannot apply it if they're in this situation for domestic violence, which is intimate partner abuse. Cultural differences. Some cultures does not see anything wrong with that. Intimate partner abuse in some cultures is not a problem. Men are considered to be superior to women. If the man feels as though the woman has stepped out of line, he feels it's his duty, and he's been taught it's his duty to discipline her, whether that's emotionally abusing her, physically abusing her, are sexually abusing her. So in these type of cultures, the abuser has been taught that that's right. The victim has been conditioned to understand that that is the way of life. They lack proper health literacy and knowledge to know that this is wrong. They've been raised that way, they're accustomed to that, and the cycle keep repeating. Gender. It does not matter whether you're male or female. One gender versus another when it comes to whether or not you have the proper knowledge does not matter. It does not matter in intimate partner abuse. Although statistics says that women are more prone to intimate partner abuse than men. Make no mistake, men are still victims of intimate partner abuse. It could be a man as the abuser, it could be a woman as the abuser. You have same sex relationships. It does not matter. Where you live does not matter. How much money you have does not matter. What race you are does not matter. Anyone is at risk for inadequate health literacy knowledge and intimate partner abuse. History of abuse, family history of abuse puts one at greater risk for being the abuser, the perpetrator, or the victim because they lack the knowledge. They've lived life that way. It's been accustomed, it's been normal in their life. So they don't understand that it's not normal. Immigrants, be it they come over to America or Americans goes to another country. If they lack the proper English or whatever language that country speaks, if they're not able to speak it or understand it, guess what? They lack health literacy knowledge. Because if they cannot, first of all, speak the language or understand the language, they're not going to be able to understand when it comes to health literacy. They're not going to understand when they go to the doctor and they're being told, you have this disease or this condition. We need you to take this medication. They go and they just take the medication. They don't have the knowledge to know how that medication is really affecting their body. They don't understand how it's curing or helping their condition. 9 times out of 10, they're not going to understand what their condition even is. If they don't understand these things, they're not going to understand if they start having side effects to that medication, how are they going to understand what they need to report? They have to be taught. These are the signs and symptoms. If you are experiencing increased nausea, vomiting, if you form a rash of any kind, to contact your physician office. They're not going to understand that. So you need to have interpreters in there with you if you're dealing with someone that does not understand your English, our English, whatever English when dealing with whatever country. Finances, as I spoke about earlier, can play a big part because a lot of times people don't have the finances to have insurance. If you don't have insurance, what's going to happen? 9 times out of 10, you're not going to go to the doctor, right? Because you don't have the insurance to pay for it. Once again, you're not gaining the proper insight on what's going on. You can't best make the best decision on your health because you don't have the proper knowledge. How does that affect intimate partner abuse? If they're not going to get help, to seek help, the cycle is going to continue. And they're going to continue to be conditioned that it's okay or even if they're not conditioned that it's okay and they know that something wrong, they don't have the proper knowledge to apply it to their situation to obtain help for themselves. Your environment, the environment you grew up in, the environment we stay in now. Crime rate is high in certain areas versus certain areas. If it's all around you, the abuser may not see anything wrong with it, and the victim may not see anything wrong with it. If it's a lack of education in that environment, guess what? You're going to have a lack of health literacy, a lack of knowledge, per se. Race, same thing. Minorities are at greater risk for health literacy. Why? Because they don't tend to have the finances to be able to obtain the resources needed to be able to have health insurance to go to the doctor. They may be living in poverty, whatever their situation may be, and it's normal in their area. They don't know better, so they can't do better. If you don't know better, you cannot do better. Say that again. If you don't know better, you cannot do better. Which put these people, intimate partner abusers, and the victims at great risk for harm because they are at risk for their what? Their safety is number one. Mental illnesses, as I spoke about earlier, got depression, got increased anxiety, panic, all kinds of different things that is altering your mental status and ultimately may cause you to form a mental illness like depression or PTSD, which is post traumatic stress disorder, or increased anxiety. They are at risk for harm, self harm, and also they are at risk of becoming the defendant. And what I mean by that is they get fed up, they don't see no way out. It's either them or the abuser, and they will react. And and sometimes death does occur in these situations when you have intimate partner abuse or any kind of abuse for that matter. When you are in fear for your life, that survival mode kicks in. These people may harm their abuser when they get to a certain point, or they may harm themselves. I want to talk a little bit about some statistics. Um, According to the National Coalition Against Domestic Violence, 10 million people a year, 10 million a year, are victims of intimate partner abuse. 10 million. 15% of which is considered violent crimes. 15% of the 10 million is considered violent crimes per year. A lot of it is college students are at greater risk. Why do we think college students are at greater risk? Well, they're young, they probably lack knowledge or health literacy. They're on college, so they feel as though the people around them are not a threat, so to speak. Um, they're more at risk for the sexual abuse because what we call date rape, where they go out on a date with somebody or they're with their intimate partner and they're forced or coerced to have sex. Well, a lot of times it goes unreported. Why? because the abuser, the attacker, doesn't even see anything wrong with it because they don't have the proper knowledge. That's their girlfriend or their boyfriend. They don't see anything wrong with it. You've gone out on a date with someone, they want what they want, they don't see anything wrong with it. The victim, a lot of times, is left feeling like it's their fault. If I had not did this wouldn't have happened. Maybe I led him or her on, and this is what caused that. It's never okay for someone to coerce you, take advantage of you, or abuse you in any kind of way, fashion, or form. I don't care who it is. But without the proper knowledge, health literacy knowledge, they cannot apply it to their situation. So they don't go report it to their campus police, or they don't go and get checked out at their campus medical facility or campus nurse or whatever. And a lot of it is left unreported. The North Carolina Department of Administration states from July of 2019 to June of 2020, Ashcombe Community College, not Ashcombe Community College, Ashcombe County had 361 victims of intimate partner violence. A greater number in women and a greater number in African Americans when it comes to race. Nash County had 466 victims, which the greater number was women and the greater number was African Americans. So, as you see, it is a problem because one victim is one too many. It is a global problem. It's not specific to your environment, to your where you live at. It's not specific to your race. It's not specific to your age. It's not specific to your education level. It's not specific to your culture, your gender, your sexual preference, or any of that. But what would help these victims is proper health care literacy. To be able to understand the information that is being given to them, to be able to understand it and apply it to their situation. I want to talk about some resources because in order to better help these victims or anyone that you come into contact with that has a health literacy deficiency or insufficient knowledge to health literacy, you first don't want to be judgmental, especially when you're dealing with victims. You want to gain a positive therapeutic relationship with them. You need to sit your thoughts, your beliefs, your feelings to the side. And you need to understand that this is about them, you providing the best care that you possibly can and advocating for your patient. Because if you don't gain their confidence, you don't gain them feeling safe with you, then you're not going to get very far with helping them. So you also want to understand that when dealing with intimate partner abuse, it is not like child abuse or elder abuse in the sense of reporting. So you need to know your state rules and regulations when it comes to reporting. Because most states you do not have to report intimate partner abuse, which is domestic violence. But in some states, you do have to report it. As a healthcare provider, it is your duty to report it in some states. So you do, if you are a healthcare provider, you do need to understand that and make sure that you properly understand and know your rules and regulations and your laws that governs your state. The National Domestic Violence Hotline, the hotline.org, which this is a good resource to give victims of intimate violence abuse. 1-800-799-SAFE. That's 1-800-799-7233. Another good resource if you're in North Carolina, in any area, it doesn't just have to be Ashcombe or Nash, but specific to Ashcombe and Nash for this assignment. It's a website called Get Help NCCADV. NCCADV.org/get help. You can go on that website and navigate through that website. It shows you can pick the county you're in, and it will bring up numbers for help that you can have to obtain resources for help for your situation. For Ashcombe and Nash counties, the crisis line number upon that website is 1-888-465-9507. This is the crisis 1-888 hotline. However, on that website, it is numbers to specific areas within these two counties that would also be great resources for anybody in that area. You need to make sure that you talk with these victims about a safety plan, escape plan, if it ever comes a time where their life is threatened or don't have to be threatened. They're in this situation, intimate violence abuse, they're tired of it, they want to get out of it. They need to know how to obtain the proper resources, where to go at for help. How are they going to escape? Whether it's support from family, providing them with these numbers so that they can call someone, calling your local police department. How are they going to get out of the situation, especially when they're in immediate danger? So you want to make sure that you speak with them about a safety plan. You want to make sure you do that with simplified information. You cannot think a person has health literacy and understands what you're saying to them. Matter of fact, you need as a healthcare provider, when you're providing information, you need to do so with the thought that the person that you are giving that information to does not have the health literacy knowledge needed. And you need to deliver that information in the most simplest form possible. And you need to make sure that they understood what you delivered to them, whether it be teach back, repeat, wait a little while, and before the interview or the appointment is over with, you can re-ask them, Mr. or Miss So-and-so, let's go over the safety plan. Let's go over the information I gave you. What is a resource that you can obtain in order to get help if you need it, if you ever need it? You want to advocate for your patients. You want to make sure that the ones that cannot speak or do not understand the language has someone there that can interpret it in their language so that they can understand it. Not only do you want to guide these people to websites, because you have to take in consideration that not everyone has access to a computer or the internet. And even with having access to it, a lot of people still does not know how to navigate it, especially if we're talking about those older age individuals, our elderly people, don't know how to navigate. And when you're talking about intimate partner abuse, you also have to take in consideration that the abuser might have that victim isolated from family, from friends, from the outside world in general, telephones, internet, you name it. They may not have access to that stuff at home or in the presence of their abuser. So you want to also make sure you give them some written information or give them these numbers in written form, somewhere where they can keep nice and safe and tucked in, and the only person that knows where it's at is them. Because if they ever get into a situation where they have to get away from that person, if they have that information on them, they can still utilize it. Whereas going to a neighbor's house and using their phone, whatever. You just want to make sure that you provide the best safe care possible that you can. And you want to make sure that you make these people feel safe. You want to make sure that you encourage them. You want to make sure you let them know that it is not okay for anyone to abuse them. Intimate partner abuse, domestic violence is not okay. You want to encourage them, uplift them, and support them in their decisions, even if you do not agree with their decisions, because it's their decision to make, not ours. Well, that concludes my video. Thank you guys for listening today. I pray that everyone is staying safe from COVID. You guys have a nice rest of your day. Bye.